Call to order the March 11th program and budget meeting, and I'll start with our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. With that, I'll take a motion to approve the agenda. Support. Motion from Megan, support from Ryan. Any questions? Seeing none, all in favor signify by saying aye. Aye. All opposed? The agenda is adopted. Next item is hearing of the public. Anybody from the public wishing to speak? You have 5 minutes. You will be on YouTube eventually. Going once, going twice. We will close hearing of the public. Next up is item 5A, request to approval of Roseland Prestige and Company PC, RPC, to complete its required annual compliance audit. I'll take a motion to approve.
Move to approve.
Motion from Nick, support from Linda. I'll turn it over to Dave.
Good evening. With Raymond in place as our interim CFO, they felt that they had a conflict in continuing to do our compliance audits. So we had to go seek somebody out. They recommended a few. We were able to close the deal with this one. It is required that we have it completed by June, so we were in a bit of a crunch. So this was a sole source 1 year. Then we'll do an RFP for the future years.
Linda?
I just want to thank staff. Was it Tracy who prepared this, the memo that goes with this? Because when I was reading what the request was, I was like, well, what happened to Raymond? And how do we know this firm is good? And then I looked in her email and her letter, and she had hit all the bullets for me. So I appreciate that detail that you gave us about it.
Thank you. Any other questions or comments? All right, seeing none, we have a motion and support. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item 5B, request to approve contract with Pediatric Special Care, Inc. for the provision of private duty nursing for enrollees on the habilitation waiver and for nursing respite beginning April 1st, 2020 through September 30th, 2021. Take a motion to approve. Motion from Kathy, support from Lori. Dave?
Don't have a lot of details on this one. The private duty nursing, it is difficult to find providers who will go into the homes and provide this level of support on an ongoing basis. We did have we had a compliance issue with one of our private duty nursing providers, and we are terminating their services because we have to protect the health and safety of the folks that they were supporting. We're keeping their contract open and processing claims while we work to get another appropriate provider in place. So we are adding some new providers in order to meet those needs, in order to separate ourselves completely from that other provider.
Nick?
How many private duty nurse cases do we have?
Not very many. I believe it's around 13, 12. I was close.
I didn't think we had that many. That's why I asked.
Any other questions or comments? All right, seeing none, we have a motion and support. All in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Next is item 5C, request to approve a request for proposal for assertive community treatment. Take a motion to approve. Motion from Chris, support from Selena. It's Adam's turn.
My turn this time. Yeah, we're just looking to increase our capacity for ACT. We have another team coming on to our directs, and we have some of our contract providers who have the ability to do this, so we just want to make sure we have enough capacity to meet the needs of our members. So we're going to be putting this out with your approval, of course.
Thank you. Any questions?
You just answered.
All right, seeing none, we have a motion and support. All in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Next is item 5D, request to approve the out-of-state travel for the Chief Privacy and Compliance Officer to attend the Basic Compliance and Ethics Academy on April 27th through the 30th, 2020 in Chicago, Illinois. Take a motion to approve.
Motion. Support.
Motion from Tony, support from Brian. Are we flying or driving? Train? We're not worried about Corona? I just got back from Disney, so it's fine. Are there any questions or comments on this item? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. All right, next we have a bunch of policy edits. We'll start with 5E, request to approve the edits made to the MCCMH MCO Policy 1-002.
So moved.
Motion from Linda. Support from Chris. Nick, did you have a question, or are you just scrolling?
Oh, I was scrolling, but my understanding is these are cleanups of policy changes we've already made for grammatical and other non-technical reasons.
That-
Correct?
That's my understanding,
That's my
yes.
understanding.
Dave
Why don't we
shaking
take
his
them
head.
all at once then?
They're updates, yes, just changing some of the language. My position title was a big one. I believe there is still some carryover from the Michigan Department of Community Health. There was some font and format changes.
Is
Nothing
this
of-
what we just got handed? Well, these are bylaws.
This is one of them, Nick.
I- I'm-
Right.
Bylaw change.
The one we were just handed was, I believe, 5-
There was a request for the
004.
red line version for that one.
So we just can't do it all one time, go E to J?
We can.
We can go E through K if everybody would like to do. Linda?
The bylaw is 5-004. Our bylaw. No, it's not. Yes, it is.
I'll make a motion that we make approval from E to K. 5E to 5K. Support.
Do we have questions and comments on any of those items? Linda, go ahead.
Well, I wanted a review of the board law, of our bylaw change. Generally, when I've been on boards before, if there was a subcommittee for bylaws and, you know, they took the action. So when I saw this, I just wanted, you know, didn't have benefit of the red, what was struck and what was added. And so now I just got it just now, and on page 3, or page 5, there's a red box where they're asking for your take on something, and so, I don't know. This isn't just a cleanup is what my comment is, I guess. This was more than just a cleanup
Well,
for our bylaw.
I'll let Dave answer, then I'll get to you.
Those
Nick.
were open questions to me. The formation of committees, whether standing or special, if you have any questions, please let me know. The only change in there was policy and legislative affairs to legislative and policy. Yeah, there really was nothing of significance in there. There was just some general questions if we wanted, I think, any changes in that area, and my response was no.
Okay.
Like I said, on page 8, it's my title change primarily. And then there was a suggestion added specific to a release.
Page 3. Page 3.
And, yeah, the confidentiality, that actually came up during the group home visit. And the thought was, instead of having to do that each and every time, if we could have that done annually by the board, we'd file it away, and we wouldn't have to bother with that, kind of make it a part of the annual process with the board of directors. And that's just a suggestion, but that's really the only update or change that was made to the bylaws.
Okay, thank you.
Thank you. Nick?
So those are the only substantive changes you're proposing? Because we had a discussion about doing a review of the bylaws once or twice. And if we're going to do substantive changes, I think Linda's right. We should do it through a bylaws special committee, I guess that would be. But if we're only talking about technical changes, I mean, I don't care whether you call my committee legislative policy or policy and legislative.
Exactly.
I've called it both, depending on what I was talking at the time. But I guess I'm trying to figure out, you're saying there are no other substantive changes except the change that allows us to get a one-time release for visiting group homes.
Yeah, the others were very minor, like I said, my title change, font
Where-
changes.
Where is that group home piece?
It's, yeah, page 3 with the non-disclosure confidentiality agreement. It's letter E on page 3 of 9, near the top.
Oh, that's for us to sign the
Yes.
confidentiality, not for them to agree. Okay.
All set, Nick?
Yeah, I'm fine.
Linda, go ahead.
I will call to Nick's attention, there is not a bylaws committee listed here on the committee.
No, but the chair has the authority to
Okay.
appoint a special committee.
You don't need to put it in, okay.
Any other questions or comments on E through K? All right, seeing none, we have a motion and support. All in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. All right, next is item 5L, request to approve the contracts for the MCCMH Marketing and Communication Strategy, Entercom Radio, Outfront Media, and Metro Parent Magazine. I'll take a motion to approve. Motion from Selena, support from Linda. Dave, did you want to speak to this at all?
No.
No?
Just to, Cynthia, I've been in communication with her today, and she's staying home. She sounds very, very bad. So I wish her the best, told her to lots of fluids and rest. She did put a lot of work into this, and she'll be prepared to give more detail at the board meeting. But this was done. We have a set budget for the marketing, and a chunk of this as well was grant funding. And I was this afternoon at Entercom recording 2 more of those radio 30-second soundbite things. We are planning to do, more and more with this, and I'll have some more updates in my presentation.
Kathy?
Thank you. I have a question about the definition of the market, because Detroit is cited. Does that mean Detroit metropolitan area, that like the 3 counties or 4, depending on what's being considered?
Yeah, I believe she meant the Detroit metropolitan area for the marketing. The radio, for example, is widespread.
Right, you can't, it's kind of hard to stop the radio waves, yeah.
Exactly.
Okay, and then the parent, Metro Parent magazine, did that include, I didn't see, does it include how many readers? Oh, 40,000 targeted readers. Do we have any data on if that is that the market we want to reach? I didn't see any real specific, like what kind of market are we looking for? And would that be something that the people we want to reach would be using that magazine?
We'll have that prepared before the board meeting.
Okay. And if there was, if not a lot of study went into it, that would be interesting to know. And if a lot did, and that's the only one that came up, I don't care what the answer is. I just would like some meaningful, hope that there was something to reach the people that we want to reach. Thank you.
Thank you, Kathy. Tony?
So it looks like we're looking for more work, more business, more service to people. Are we prepared to, if this becomes a rush, people coming at us asking for services, are we prepared to handle that load?
Yeah, that's always a concern, but that's why you have some of these RFPs out to expand our provider network. And we're also working, looking closely at the call center, call volume, and we have some grants coming along that will help us along that path.
Thank you.
Any other questions or comments? Brian?
I just want to say, from personal experience, in the last month, I've had 2 people I know, 24 years old, committed suicide. And in this messaging, is there going to be some targeted about suicide prevention? Are we aware of it? Because, I mean, it seems like it's a short time frame, and I'm hearing it's more and more with that age,
Third leading
more and more
cause of death
becoming more
for people
prevalent
under
for suicide.
That's a very good point. I'll double check with Cindy and see if we have anything targeted in that area.
Sorry for cutting you off, but also the aspect for family members surviving suicides.
The one I did today was on overdose and fentanyl, and there was a general one with our crisis line that we're here to help. So I would touch on that, but I did not go specifically into suicide. Those were the radio. No, I understand, and I'll follow up.
All right, thank you.
Thank you. Any other questions or comments? All right, seeing none, we have a motion and support. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next item, receive and file. I don't believe we have anything to receive and file. We'll move on to 7, resolutions. No resolutions. Other agenda items. Anybody with any other agenda items before I turn it over to Dave? Nice job to all those applicants today at our very lengthy board meeting and in front of a very lively crowd. You all did a wonderful job. Dave, go ahead.
Good evening. I had I'm doing rounds to our various sites, and I met with the staff at our Garfield site today. And I had my notes and everything, but of course I had to go off of those and speak to the coronavirus. We met after that meeting, and we've been meeting ahead of that as well, working very closely with the health department, with our medical director, Dr. Serpa. She sent numerous emails out to staff about actions they should be taking, keeping everybody informed, website links to additional information. And that's kind of our message out to the staff. We are part of an alert system, and that's statewide. And because of the email connections, I shared something from the Community Mental Health Association. They've sent out an email as reminding people that they can call in to their meetings. They've shared information from the federal government, from CMS that we're distributing. We did, I think Linda, you mentioned the folks in the adult foster care homes and, any group setting like that. So I did instruct Christina, our chief network officer, And we have an email distribution list that we're validating to make sure it's all current, so that we can get information out to that group specifically. And we just continue to monitor the situation, and we're following up, and we're getting more and more details internally. We'll have a really good plan, hopefully by the time it hits Macomb County, so stay tuned. Also this week, the CCBHC, it's a Certified Community Behavioral Health Center. It's a federal grant. It's $2 million max over a two-year period. The deadline was March 10th, which I think was yesterday. It's kind of a blur. I do have to publicly thank Jim Losey for taking point on that. Macomb went to apply, was prepared to apply in 2016, but Michigan was not selected as one of the planning states. This time around, it was open to more people. So we had a deadline of, I guess, 11:59 p.m. Yesterday. Luckily, we didn't go that far, but it was about 6:45 when we got everything to go through the system and get it accepted through there. So we had a number of staff, Tracy's here in the audience, and the finance staff were helpful in pulling information together in order to get that submitted. So I think it was, it's good, and I think it'll get the attention of the folks at SAMHSA, and we'll keep you updated to see if we are selected or not. I'm pretty sure I sent out that gloom and doom email that not only had Barb retired, somebody else thought, hey, what the heck, I'll retire too. So put her on a spot a little bit. Lynn gave notice, caught me by surprise, but I was able to reach out and get creative, and you'll notice in the audience near the back, under the commissioner lettering, she loves to be pointed out in public, is Sandy Hayes. I worked with Sandy previously. Adam and I both did. And luckily, the timing was right. Sandy's working as a temp through America's Back Office while the position gets posted and we go through those channels. But she's working closely with Lynn, and Lynn was gracious enough to continue to work with Sandy part-time during this transition and to be available at the next board meetings for the next couple of months. So thank you for that. So you'll be seeing more of Sandy, and I went to send an email to Sandy the other day, and she wasn't even in the system yet. But we'll get her email up and running, and you'll be receiving messages from her, and that's our plan going forward. So welcome, Sandy. On the finance side, we do have Raymond in place and Richard Carpenter as our interim CFO. We had a staff meeting at the administrative offices yesterday. I introduced Ken, who's an accountant with Raymond. He's in the office on a fairly regular basis. And then we have Carrie, who's working with Heather Gilbert. And Heather, I heard, was offered the position. So Heather's being promoted to replace Kathleen, who was the finance person for the substance use services. So we promoted from within. We're supporting Heather with Carrie until she's comfortable in that position. I had not really interacted with Heather much. She interviewed really well. So I was very happy to be able to offer her that position. And then, like I said, we'll support her while we go through this process. The CFO position should be posted out shortly, and we'll continue to follow up along those lines. I was in Lansing Monday morning with Richard, and that was a super exciting meeting with the folks from Milliman about the capitation rate development. Their calculations show that they're off by $120 million from the projections to what's happening in actual. So they're planning to change our capitation rates April through September to make those adjustments. They went through the numerous problems with the funding model and what they had done to correct those. And they're putting right now they're doing some monthly reports while they work to get things automated, which won't happen until about June. So it was kind of a long, drawn-out, very detailed meeting about how they develop our capitation rates. The outcome, though, is fairly positive, and our capitation rates will be increasing. Also at the staff meetings, I announced we're a little difficult to access if you're a member of our community and you're trying to find us on our website or figure out what's what. I was working with Cyndia to set up this time at the staff meetings, and she got all confused about trying to set up a meeting at First Southwest and CCC and a 15-mile road site in VDPS and Access, because those are all the same spot. And we met internally, said pretty much enough's enough. TJ is looking at some signage cost for us, reasonable signage cost. We're going to look at that. The First Resources North building as a prime example. I've driven by that building for decades, never once connected it to the community mental health system. My Care has some decent signage on either side of the building. What we're looking at is it'll have our logo and it'll say Macomb County Community Mental Health North. First Southeast will be Macomb County Community Mental Health South. The 15-mile road site with all the names will be Macomb County CMH West. The Garfield site will be Central. Admin will be admin. And it'll be Children's Services. It'll be Macomb County Community Mental Health Children's Services as opposed to SCFS, which again means nothing to anybody. We're trying to make it, and it's in connection with the new website, which will be rolled out, I believe, next week. Thank you to all the board members who had their photos taken for the new website.
Tony for the pin.
Tony for the pin that went around and around. They'll be easier to, the naming will be on our website, the locations will be there, the phone numbers will be there, and it's all about making us more recognizable to the community as we go forward. So those are some of the updates. Yes.
Lynn, we are sorry to see you leave, but excited for your new chapter. Will we be replacing both Barb and Lynn with two people, or are we just going to replace one and join the duties?
Good question. Haven't talked to Sandy. No. I did mention it to Sandy. We very well might have a single person in both of those positions, at least at first, to see how it goes. Adam can be very difficult to work with. I'm very independent, so we'll see how that goes.
I heard it was the opposite.
From who?
Well, they're both leaving, they're both secretaries left. I know.
Yeah, again, that was Adam.
Well, Lynn didn't leave until she got moved into Barb's role.
I keep promoting people and they keep leaving.
I'm just gonna say.
I told Lynn, I'm like, I solved all the issues, and then I promoted 3 people who have subsequently left very shortly thereafter. So I'm like, I'm going to stop promoting people. I'm going to demote Adam so he stays. It's frustrating to say the least when, because it takes a bit of work to get all of that through. We had done a reclassification for Lynn, so it was official as but if you'd like to make her feel bad and give her a hard time, it's welcome.
Congratulations.
Nick?
Yeah, no offense to Sandy, but Lynn, you can leave. We hate to see you go, and we congratulate you on your retirement. Dave, on the financial conditions, and you've been giving us sort of running ups and downs and rounds and so forth with the state dollars for some time. Will we have a full financial interim report at this month's meeting? It's March already, and as the person who got to be the dubious representative, have the dubious honor of trying to represent this board at the full board meeting on those issues, because I spoke first. But they assured me it was only because I spoke first, that we really do need to see where we are and where we are in better terms. I don't think the board has a full picture. At least I don't feel as I have a full picture to be able to explain these settings, and that
Richard is preparing a report to the board, and he'll be attending the board meetings on a regular basis.
Including this month?
I believe so, yes.
Okay.
I can tell you that the state did move the year-end close deadline from the end of February to March 13th. So we will have all of our information to the department by March 13th. Last I heard, we would be contributing about $7 million to the ISF. We have just under $6 million in unrestricted funds. The general fund surplus has been reduced as a result of the settling the compliance issue with private duty nursing on our books. So we had to void a number of claims on our system, and then it was appropriate to use the general fund dollars. We couldn't pay those claims with Medicaid dollars because they had been ruled to be non-compliant. So our general fund surplus was reduced. There was a number of other smaller items that had been hanging onto our books for 5+ years. With Richard in place and working with our current finance staff, they went through all of those. So going forward, we have a much cleaner financial books going forward, and we are in a very good position going forward. But yes, you'll have all the details. And actually, we discussed a board study session, so you all could meet Richard, spend some time with Richard. He could go through his approach and just a general overview of the financial information that he'd be presenting to the board on a regular basis to kind of start everybody off at the same level.
And one other question on the dead folks from 5 years ago adjustment issue. Where are we on that?
Yeah, they call it the death audit, which
The
is
death
just,
audit, which,
I'm like, I wish, before it was the deceased beneficiaries, and then they just shorthanded it to the death audit. That was part of the discussion on Monday. They did they did not take the funding back for that in March. And it's still, some of the PIHPs found issue with the detail that the state had sent over supporting that take back, which again for us was just over $2 million. So the state's looking at reworking that, and then with the additional shortages that they're seeing on the revenue side, I'm not sure how that all is going to pan out, but Richard will give us an update on that.
Has there been any further discussion on potential legal challenges? I know the PIHPs were discussing it, and I had urged you at the last meeting to consult with our corporate counsel.
Nothing formal because all the details are still being worked out, but there is legal grounds there that since they funded us for deceased beneficiaries going back to 2014, that all of that revenue was in our system, and the Milliman funding model was based on those numbers, that in fact fiscal year 15, 16, 17, 18 were not actuarially based, which is a requirement. They did note in the Monday's meeting that the funding, the issues that they found with their revenue modeling, they changed the whole funding model for this fiscal year, and that it was so wrong that they do have to actually make adjustments and formal adjustments that would go through the legislators to increase our funding to cover the shortages. So beyond that and how the deceased beneficiaries play into that, we're going to have to see how they settle those books, but it's still an open issue. So no, there was no discussion at the state level or with the other PIHP specific to follow-up legal action at this time, but we're getting more details, if that helps.
Selena?
I'm glad to hear that we're going to have a board work session so that we can, meet him a little bit better. But over the past year and a half, and maybe even longer, we have raised numerous concerns about the report out that we got on our budget. Half the reports didn't make sense. We asked for details. We asked for where we were at currently. We never got answers. When we get this report out, is it going to continue to look the way it did previously, or are we going to be able to say we had this much money allocated for this and we're right on schedule for this year, or you know what, we're overusing it here and underspending it here? We've never been able to get those answers. I asked for them numerous times. As a board which is responsible for this, we really don't have an idea, and we're really at the mercy of a colored piece of pie chart that she would give us. So I'm hoping that we will be able to sit down and have a realistic budget, and so that as we're going through by quarter, and I understand as well as you guys all do, that it's very fluid, and I get that. But we never know where we're at until it is at the last minute and we're trying to put out fires. So will we be able to get a better looking and appreciate, what we're seeing with some real data at that moment? I get it that it's a glimpse in time, to have a better understanding of what we are at. And then the other thing is that will we be able to put together some type of work session and start looking at some of the contracts that we have? And I know I've expressed, a few times that there's a couple contracts that we have that I'm not so sure are in the best interest. And will we be able to see numbers coming out of those contracts? Like, how much are we really spending on it? Are we really receiving the services for the money that we are spending on that contract? Are we getting the care that we need for the people that we're serving? Because, some of them have been in place for so many years, and they just keep getting renewed over and over and over. And have we really looked into them for quality measures? And I know that Christina does a good job, and she does, but I question some of them. Is it time to really start rethinking what we do and where we're headed?
Yes. Yeah, I think you're going to be very happy with the information, the financial information you get going forward. And you will have definite input. So if what Richard shows you if you guys would like to see it in a different format, anything like that, or some additional detail, that's, will always be available to you. But there will be a set graphs, charts, reports, information on a regular basis from next month forward. And you'll always be able to ask for the supporting detail for that. As to the contracts, we are working, we're part of we paid some money to be part of a learning collaborative for value-based contracting, and we're having some interesting discussions along those lines. It'll be a change for us, and I'm going to be meeting with Aaron Thomas to make sure that the way those are written, I've had experience with those before, and there's just some easy areas to kind of start with. But we will be looking at the value of those services, how they're funded. Adam and I are meeting here soon about some rate meetings. When I ask, I'm told that we have a set rate, and then I run a detailed report, and it's the opposite of a set rate. I mean, it's, like 100+ different rates for the same service. I have rates that range from $1.37 to $50. I'm kind of baffled. So I'm getting my arms around those, and with the finance team we have in place now, that'll be a priority.
And I'm happy to hear that, because when I take a look at even some of my own facilities and bump them up against other facilities, the rates are not consistent. And that is one of the concerns that I've had, is that, depending on when the contract was renewed and who spoke the loudest determined sometimes what the rate would be reimbursed. And those that sit back and just keep on, getting that renewed contract, and we don't, cause a fuss because we understand the bigger picture. I think that we have got this wide range now that we're paying that maybe we have to take a look at. So I really I'm glad that you guys are doing that. I think that it's needed. I don't want to say, okay, we got money, and then all of a sudden we go out and we run around and we start spending money. We still have to continue doing what we're doing. We have to continue, organizing and fine-tuning everything else before we go out and say, okay, I got $6 million. How can we spend it? It's not about, this contract and raising this rate and doing that. We have to be consistent, and that is the only way we're going to succeed. We've come a long way, and we are now seeing other CMHs in the state that are where we were 3 years ago, and they, shame on them for not learning from us. And so I really hate for us to go back, but keep on moving forward and, fine-tune what we're continuing to do. Thank you.
I agree
I appreciate
completely.
it.
So.
Linda?
I just need clarification. I think I heard two things. So the meeting with Richard he's presenting it. We haven't had any financial information in 5 to 6 months. That's, shame on us, but for not asking for it sooner maybe. But so it's going to be a full board, or then I heard somebody say a work group.
Yeah, I mentioned him presenting at the board meetings, and
Okay.
then I added that I had talked to Richard, and we are planning a
Okay.
board study session, and he'll go over the information that he would recommend be presented at the board meetings, and then he'll be taking questions and feedback. But you'll come up, at the end result will be a packet of information that's consistently presented on an ongoing basis, and it will be a rolling, so you'll be able to keep things in perspective.
Great, thank you.
Do we have a date for the work session?
Not yet, no. I'll be working with Sandy to schedule that.
Phil will do it right here. No, just kidding.
Yeah, Sandy's here. Let's do it. No. Anybody else with any other questions or comments for Dave? All right. See, Brian,
With this virus,
turn your microphone on. Everybody wants to hear you.
Really. With this virus that's going around, it seems more and more that it's getting someone into a panic situation. I mean, I've seen reports that now they're fighting over toilet paper. And I know that there's a shortage of sterilized equipment and facilities. And my question is, is our plan in place for the group homes for a safety net? I know washing hands is the most important thing to stop it, but with our group homes, I mean, is there a way to protect the workers? Is there something in place for that? Or is that just way out of step to even try to think about it because it's a home care, I mean, it's a home situation, I understand that, I mean, but I've heard that nursing homes are now shutting down visitors for coming in the state of Michigan. I mean, and then they're so ill-trained, they're even turning away respite nurses or hospice nurses to come in and see the patients because they say, well, you're a visitor, you can't come in. They're registered nurses. I mean, is that something that's been already in place, or is that something that's being looked at?
Like I said, education is the key right now. The CMS just today issued guidelines for home health care workers, which would be a close correlation with our direct care workers and community living support staff. So we'll be sharing that information, getting it out. We did that distribution list specific to the group home providers. So we make sure that there's a good steady stream of good, accurate information to that group. We'll respond to any of their questions. I had a question at the staff meeting today. You know, we have staff going into those homes, monitoring them and things like that. So we'll be getting information out to our staff too that has been vetted through Dr. Serpa, our medical director. So it's the same precautions that you're hearing on the news right now. Keep a safe distance, limit your travel, limit your group activities out in public. And, you know, that's pretty much all we can do. We'll be monitoring some of that, but a lot of it is we're just dependent on those group home providers implementing what the information we're sharing with them.
Okay, thank you for that part of it, but what about the toilet paper supply? I mean, that's a basic necessity, and some of it I've seen in the last couple hours, personally, I think it's absolutely ridiculous.
I agree with the ridiculous part.
But it's just, that's a necessity. Is there a situation?
You can still buy toilet paper. It was out at Costco. So if you wanted to buy, you know, a pallet of toilet paper, you probably couldn't do that at Costco, but it's still available here.
I'm concerned about the group homes. If that's going around where they buy their supply from, I don't know how that system works. If they supply each group home by themselves, or each resident does that, or is there just a backup facility that we could put in place in case there's an area that does run out, that to be able to get it?
We can do some checking, but toilet paper wasn't part of our immediate crisis response.
I understand that.
Yeah. So no, we do depend on them to purchase needed equipment, gloves, mask, the sanitizers to wipe down those surfaces. I was a direct care worker way back, and everything was wiped down with, you know, bleach water, diluted and stuff. It's been common practice for decades. So hopefully these reminders about those universal precautions will be helpful to that group. But
And like I said, I mean, I've been in the stores. The shelves are empty.
yeah, no, I was at
I mean, like
Costco
the
on
hand
Sunday.
sanitizer, so they said, you know, that doesn't really work, and they just go use the soap. And they just wipe it out, and all of a sudden they get hand sanitizer on Amazon for $59.
Yeah, there's a ridiculous factor for sure, so.
All right, thank you.
Anyone else? Nick?
Just along those lines, Amazon is 3 weeks back ordered on toilet paper. But you're right, you can't get it at even Kroger's and Costco's. There's different places. It's difficult, almost impossible to get hand sanitizers, but you can make your own. I understand there's a formula for one on the internet. The CDC, I just got a notice from, I sit on the board of directors of the Mental Health Association in Michigan, who sent out a copy of the CDC's guidelines and recommendations on the general sorts of things for normal employers, not even for health employers, that we've implemented among our workforce. So I assume that's what you're using, something from the CDC as in terms of what you've distributed as a reminder to our contractors.
Yeah, that was those fact sheets went out early. Monday morning, I have a conflict, but I believe Adam and Tracy are attending a meeting with the county folks. Like I said, we met with the health department earlier today. Their alerts keep coming out. We're part of MyHAN, which is the Michigan Health Alert Network, if I got that acronym right. So we get the email alerts. They have my cell phone number and Adam's cell phone number, personal cell. You were the tertiary, I think, contact on that. They have Dr. Serpa's and Tracy's. I have updated all of our emergency contact information, and we're tracking it closely.
And just as a point of information to my Irish friends, since my wife is Irish, I just got a text that they've canceled the St. Patrick's Day parade.
They did in Chicago.
In Detroit. Detroit just, New York was, there's a battle between the governor and the mayor of New York as to whether to cancel New York. Chicago was canceled. She got a call earlier today asking her for her vote of the association she's president of, which is part of the United Irish Societies, which does the parade. But then there was a meeting between, or I assume a call between Mayor Duggan and the governor, and the decision was made to cancel it this afternoon.
Well, that's not going to deter the Irish at all.
Yeah, Linda's still gonna go.
No, Columbus Day isn't until October. So.
All right, anybody else with any other agenda items? Kathy?
I do, thank you. Through the chair, if I could ask Tracy, could you give us an update on the CEO salary that we had approved?
Yes, I spoke with HR earlier today. They've confirmed that they've accepted, that they have the document, they will process it. It was submitted to payroll, but I did check right before coming here, and it's not been done in the system yet. But they assured me verbally that it would be done.
Thank you.
Anyone else? St. Patrick's Day party on Dave. All right, seeing none, we'll close other agenda items and move to hearing of the public. Anybody from the public going once, twice, 3 times? We'll close hearing of the public. I'll take a motion to adjourn. Motion from Selena, support from Kathy. All in favor? Aye, we are adjourned. Thank you all.